Hello everyone. Good morning. So guys, again today I am live on both my YouTube as well as the Instagram, and yesterday I felt that it was much liked because many people are not using Instagram. Good morning. Hi. Yes, so I know this is a very feared topic, and that's why when I asked yesterday that what would be my next topic after the astigmatism, this was the most desired topic. So I thought that I'll take this today. So how many of you are ready for studying the Squint? Hi, the people who are on YouTube. Hello, everyone. Welcome to the session. Welcome to the people who are live on Instagram also. Hi. So, yeah. So I hope people you are giving the quiz also, and you are going fine with your preparation of the examination, and by this way we can be in touch, you can be on your track, and you can be consistent, because the most important problem for the preparation of examination is how to be on track. So shall we start, guys? Right. So when we start with the squint, actually first we have to understand the anatomy and physiology of the extraocular muscles, and then we are going to read the actual squint. So how many extraocular muscles we have? We have actually the 7 pair of extraocular muscles. Now you have to be very clear when we talk about the extraocular muscles. Most of the times we feel that it is 6, right? Many people, when I ask this in the class also, what is the answer they are going to give? That we have got the 6 pair. No, it is not 6, it is the 7 pair of the extraocular muscles. So one is your LPS muscle, then we have got the 4 rectus muscles, and then we have got the 2 oblique muscles. So whenever I am talking about the squint, actually I am talking about these 7 pair of extraocular muscles, and all of them have the same nerve supply also. All of them will have the same nerve supply also. So we have LPS, that is levator, palpebrae, superioris. Then we have got the 4 rectus, superior rectus, inferior rectus, medial rectus, lateral rectus, and 2 obliques, superior oblique and inferior oblique. Is that okay, guys? So we have talked about the extraocular muscles, the name of the muscles. Now I will talk about its nerve supply, and then we are going to talk about its sections also, right? So nerve supply के लिए remember a very simple formula that we have all three, SO4 and LR6. All three, SO4, LR6. Now this is a very important formula, very simple formula, very easy to remember. All the extraocular muscles are supplied by which nerve? Third cranial nerve, oculomotor nerve, except for 2 important muscles, SO4, LR6. SO means superior oblique, 4 means the 4th cranial nerve, and then we have LR6, lateral rectus, is supplied by the 6th cranial nerve. So we have done with the names, we have done with the nerve supply. Now I will talk about the actions of these muscles. So LPS muscle is levator. Levator means elevation. So this will cause the elevation of palpebrae. Palpebrae means eyelid. So it is going to elevate the upper eyelid. Now who can tell me that if I am not able to elevate my eyelid, okay, then what will happen? I am saying that LPS muscle helps in elevation of the eyelid. So if there is a palsy of the LPS muscle, then what can happen? Hello everyone, guys, can you answer this question? So if I am not able to elevate the eyelid, it will droop down. What is this called as? Yes, so very correctly Shumel has answered, there will be ptosis. Pragya, you are also correct. So I am getting so many messages on both. So it will be actually ptosis. So always remember, whenever we have ptosis, this can also occur by the third nerve palsy due to the LPS palsy. Okay. Now we will be talking about SO4 and LR6. So superior oblique muscle will be paralyzed when there is a fourth nerve palsy, and the lateral rectus will be paralyzed when there is a sixth nerve palsy. Now, meanwhile, I am discussing the actions of these muscles. Who can answer me that what can be the causes of sixth nerve palsy? What can be the causes of sixth nerve palsy? Meanwhile, I am telling you the actions of these muscles. Now, remember that one is rectus muscle, one is oblique muscle. Rectus means straight and the oblique means tilted. Now, this is the most important concept that you will have to understand, that one is the rectus muscle and one is oblique muscle. Rectus means straight, so they are inserted straight into the sclera. When I am saying straight, it is almost straight, but they are not completely straight. Okay, it is almost straight but not completely straight, because still they are inserted at a very small angle, that is 23 degree. Now afterwards I will tell you this also, that from where this 23 degrees had erupted. Okay, so they are actually inserted at a very small degree, that is 23 degree. But when we talk about the oblique muscles, these are the tilted muscles and they are inserted at a very large angle, and this large angle is 51 degree. 23 degree, 51 degree. So it is very large angle compared to the rectus muscle, and that defines the difference between the action of these muscles. Now when I say it is a rectus muscle, they are going just straight. So their primary action is going straight in same direction. Now guys, always remember S for straight and S for same. It is S for straight and S for same. So rectus muscles will go straight in the same direction. So superior rectus will go superiorly, inferior rectus will go inferiorly, medial rectus will go medially, and the lateral rectus will go laterally. So primary actions, what will be the primary actions? Going straight in the same direction. Superior rectus straight up, elevation. Inferior rectus straight down, depression. Then medial rectus straight medially, that will be adduction, and lateral rectus straight laterally, that will be abduction. Whenever they are talking about the primary actions of these muscles, it is very simple. You have to just see that they will go straight in the same direction. It is elevation, depression, adduction, abduction. But when they talk about the oblique muscles, these are the ulta muscles, these are the tilted muscles, and therefore their main action is rotatory. Okay, they are always acting as a pulley because they are inserted at a very large angle. So their main action is not elevation, depression. Their main action will be intorsion and extorsion. In means inward and ex means outward. Okay, so intorsion is inward rotation and extorsion is outward rotation. So their primary action will be intorsion and extorsion. Now you have to remember two mnemonics. One is sin and one is rad. One is sin, one is rad. Sin means superiors are intorter. Superior muscles are always intorter muscles. It can be superior rectus. It can be superior oblique also. Superior rectus will also cause intorsion. Superior oblique will also cause intorsion. And what will be the opposite of this? Opposite of this will be that inferiors will cause extorsion. So both inferior rectus and inferior obliques will cause extorsion. Okay, now you will say, then what is the difference? The difference is that for obliques it is primary action, okay, but for rectus it is secondary action. What is the primary action of rectus muscles? Straight in the same direction. So it is elevation, depression, adduction, abduction. What is the primary action of the oblique muscles, guys? It is the intorsion, extorsion. How will you decide which will cause intorsion, which will cause extorsion? So for this, you have to remember sin. So superiors are in tortoise, so superior oblique will cause intorsion and inferiors will cause extorsion. Are you getting this? So can I have a heart? Can I have a wave if you have understood this? Then we are going to talk about the tertiary actions of these muscles. Then we are going to talk about tertiary actions. So tertiary बहुत simple है. You have to just remember rad. Red means recti are adductors. That means recti are adductor muscles. So rectus muscle will always cause adduction. So whether it is superior rectus, whether it is inferior rectus, tertiary action is adduction. While if I talk about the obliques, it will be just the opposite. Whether it is superior oblique or whether it is inferior oblique, it will always cause abduction. Are you getting, guys? My YouTube viewers as well as my Insta viewers, please give me a heart so that I get to know that you have understood. Wave, thumbs up, whatever you want, anything. Hi, and I appreciate that many people want to be in my live video, but sorry, I cannot accept this request. So please see, have you understood the actions of the extraocular muscles? Can I have a heart, thumbs up, wave, anything so that I get to know that you have understood? Shumel has said yes, ma'am. Thank you so much, guys. So many people have given me heart and wave. I can see. All right. So, so I think हिंदी भी बोल दो मैम. तो हिंदी के लिए गाइज आई एम थिंकिंग कि आई कैन हैव अ सेपरेट सेशन इन द इवनिंग जिसमें हम हिंदी में सेशन करेंगे. व्हाट डू यू से? इंग्लिश में मॉर्निंग में हम कर सकते हैं मॉर्निंग ब्रेकफास्ट इंग्लिश, एंड हिंदी आई कैन डू इन द इवनिंग. So tell me about this also. Ki is that fine for you? 7 p.m. 7 p.m. पे we can do a Hindi session of the same topic. तो those who are more interested, more comfortable with the Hindi, तो हम हिंदी कर सकते हैं in the evening sometimes. ठीक है ना? तो I can see बहुत सारे smileys आ रहे हैं. Now, I have not talked about the medial rectus as well as lateral rectus when I have talked about the secondary actions and the tertiary actions. Why? Because medial rectus and the lateral rectus will not have any secondary action, no tertiary action. No secondary, no tertiary. So, Priya, full of the video will be available afterwards also, so you can always look at the video. We have talked about the 7 extraocular muscles, LPS muscle, 4 rectus muscles, 2 oblique muscles along with their nerve supply, all 3 SO4, LR6 along with their actions. We have talked about actions may we have got the rectus muscles which are going straight in the same direction. Oblique muscles will have rotatory action. The rectus muscles के primary action straight in the same direction. So it is elevation, depression, adduction, abduction. And for the oblique muscles, we will have the intorsion and extorsion. Now, when I talk about intorsion and extorsion, remember the mnemonic sin. Superiors are intorters and inferiors are extorters. So, superior oblique and superior rectus will cause intorsion, and inferior oblique and inferior rectus will cause extorsion. ठीक है? Now difference क्या है? For the rectus muscle, primary action is elevation, depression, while for the oblique muscles, primary action is intorsion, extorsion. So this will become ulta in the cases of secondary. Secondary of the rectus will be intorsion, extorsion. Secondary of the oblique muscle will be elevation, depression. And for the tertiary, just remember recti are adductors. Recti are adductors. ये हो गए इसके actions. So whenever you have any nerve palsy, today with the help of this Squint concept, we are learning how to solve the questions related to the nerve palsy. So what will happen, guys, if there is a third nerve palsy and you people have not answered the question for the examples where you can get the 6th nerve palsy? And those who are joining new, let me tell you guys that daily I am coming live on Insta as well as YouTube. So those of your friends who do not have Instagram and they are looking forward for the sessions, so there's no need to worry. They can also watch the YouTube session. YouTube also we are doing live at the same time. Okay, and these sessions on the request I am not deleting them, and they are available afterwards also. So those of you are in the class or doing some other work at this time can also watch these sessions later. Please share the videos to those people who will benefit from this video. Okay, and daily we are conducting the quiz on the Telegram 10 p.m. pay, and soon I am going to plan something for the discussion of the topics of the Telegram. Right now my both the phones are engaged, so I'll get one more device for the discussion of the Telegram question. So if a person has a third nerve palsy, now what can happen? All the muscles will get paralyzed except for the two muscles which have a different nerve supply, that is your superior oblique and the lateral rectus. So obviously now my eye can work only, the eye can do only those movements which are done by superior oblique and the lateral rectus. Now what are the actions of superior oblique? Oblique hai, therefore intorsion extorsion. Superiors will cause intorsion, so its primary action is intorsion. My eye can cause intorsion. Then number two is your the elevation depression, and you know O for oblique and O for opposite ulta muscles हैं, तो superior will cause depression, and tertiary के लिए we have rad, recti are adductors, so it's a oblique muscle, it will cause abduction. So what are the three actions that my eye can do? Intorsion, depression, abduction. Okay, very good, Shumil. And what will be the action of lateral rectus? Lateral rectus is also causing abduction. So see, abduction is done by two. Hi everyone, hello everyone. Welcome to the live sessions. We are discussing the extraocular muscles along with their actions and the nerve supply, the part of the squint. Okay, so abduction. Now let us revise some of the questions that can be asked related to this. Which action is spared maximally? The action which is spared maximally is the abduction. The action which is paired maximally is the abduction. Okay, now I will be in depression, I will be in abduction. So what will be the deviation of the eye? Deviation of the eye will be down and out. So if you are able to see the eye which is down and out straightforward, you know that this is actually what? This is actually third nerve palsy. Now when there is a third nerve palsy, LPS muscle is also paralyzed, so ptosis will also be there. So whenever you have a question on the third nerve palsy, down and out will be there, abduction will be spared, ptosis will be there, and pupil will be dilated. Fourth important thing, pupil dilated, no pupillary reflexes, because third nerve is efferent nerve. Okay, which is efferent nerve of the pupillary reflexes, it is third nerve. So pupil will be dilated. If you remember these four things, definitely you can solve any question related to the nerve palsies. Now the question that I asked you, what can be the causes of sixth nerve palsy? So sixth nerve passes through the center of cavernous sinus, guys, है ना, of the with anatomy. So if you remember your ophthalmology details along with your anatomy details, cavernous sinus, very important sinus, largest sinus है, paired sinus है, and what structures are passing through center? It is the sixth nerve along with your internal carotid artery. So whenever we have some pathology of the cavernous sinus, we can have cavernous sinus thrombosis, we can have fistulas related to cavernous sinus. Then in those cases, we can have the sixth nerve palsy. Sixth nerve palsy means lateral rectus palsy, and lateral rectus will help us looking laterally. So what do you have to remember? Diplopia in the lateral gaze. That is why diplopia in the lateral gaze. So whenever you get a question on the sixth nerve palsy, or whenever you get in the question that there is a diplopia in the lateral gaze, then always remember that it is a case of the sixth nerve palsy. Sixth nerve palsy ka most common cause is the raised ICT. Raised ICT can occur in brain trauma, head trauma. This can occur in the TB, meningitis. This can occur in the tumors also, intracranial tumors. But don't say tumors as the first cause. Whenever we talk about the causes, tumors are important. They are severe, but they are never the most common causes. Okay. So this is your sixth nerve palsy. And then we have superior oblique. Superior oblique will help in depression. That is why whenever we have the superior oblique palsy, due to this, what can happen? Eye can go into hypertropias. Due to this, eyes can go into hypertropias. So we can have a vertical squint. So maybe tomorrow we will be talking about the vertical squint and the Park 3-step test, another important blockbuster that many people have asked for. So tomorrow we can talk about the superior oblique palsy, hypertropias, hypotropias, along with the Park's 3-step test. Okay, guys. So if you have any doubts or queries in the things that we have done today, you can ask any question, any doubt. Yesterday, somebody asked me how to differentiate between the fundus of a retinitis pigmentosa and the salt and pepper retinitis. So it's a very good question, and whenever we discuss the fundus of RP in the classes, I do always mention how to differentiate it from salt and pepper retinitis. So always remember salt and pepper. So we have white and black both. In the retinitis pigmentosa, you do not have white, hai na? You have only the pigmentation. Second important thing, you will have triad of retinitis pigmentosa. Triad of retinitis pigmentosa in RP fundus means pale yellow waxy optic disc will also be there, pigmentary spicules will be there, and we will have arteriolar attenuation. So the triad of RP obviously will not be available in the salt and pepper retinitis. Second important thing. Now the third important thing, they can give you some systemic association of RP. We can have Bardet-Biedl syndrome, we can have Cockaynes syndrome, Besson-Conswick syndrome, Kearns-Sayre syndrome, Refsum syndrome, Usher syndrome. So they will also give you some associated features. Nystagmus hai, ataxia hai, peripheral neuropathy, all these things can be there. Okay, myasthenia gravis is not associated feature of retinitis pigmentosa, Shumel, if you are asking for this. Then you can also get some causes of your salt and pepper retinitis if the question is on that. So the causes of salt and pepper retinitis may you will have the congenital rubella and congenital syphilis. That will be the most important causes. Uske alawa we can also have phenothiazine toxicity. So if you remember this much, there will be no difficulty in differentiating between the fundus of the retinitis pigmentosa as well as salt and pepper retinitis. Now always remember one thing, that they will not give you just the fundus image and ask you for the spot diagnosis. In these cases, whenever there is a confusion, and then what will happen, there will be actually one or two words or one or two lines which will always be there, that will help you, that will give you a concrete evidence that whether it is rubella, whether it is syphilis, whether it is salt and pepper retinitis, or whether it is the retinitis pigmentosa. I always say that few people are not doing the post graduation in ophthalmology, so they are not expecting just the spot diagnosis. Okay, either they will not keep the close options then in the questions. Okay, they are not going to give you the close options. So that is the best way. Always look for the related things also, and then you can easily find out what is the answer. So I think I have answered the question also, guys. If you have any other query related to the thing, you can tell me. Please join the Telegram group, because I'm planning for the questions discussions also that I'm giving to the quiz. Okay, and on the Telegram I want you to interact with me and give me a feedback that what are the other topics that you want me to take first as the live discussions. So I hope you people are benefiting from this, and I have solved the problem of the Instagram. Those people who are not on Instagram, no problem, you people can watch the live on YouTube, and for your convenience I am keeping these videos for some time. Okay, they are not available for infinite period, but certainly they are available for some time, because everybody might not be available on at the live session. So please watch them quickly for a week or so. I am going to keep them, and then I am going to remove these videos. Okay, so don't take it for granted. And why I am removing, actually this is also for your own sake, because if they are available for the infinite period, then obviously you will be, complacent, and you won't see them. So there should be a termination point of everything. So for a week I am keeping these videos, and after that these videos will be removed. So please watch these videos as early as possible. Share these videos with your colleagues. So join the Instagram, join, subscribe to the YouTube channel, and join the Telegram group also. And see you tomorrow again with the part 3 step test, both nerve palsy, some more concept of the squint. And in the evening I'll try to come again, and we can talk on the same topic, maybe in Hindi, for the Hindi lovers. So goodbye guys, thank you so much for your patience, thank you so much for attending the session. And do study today, see if you have any doubt, and we can again take the doubts tomorrow. Goodbye guys, take care, take care. Thank you so much guys, thank you. I hope you have understood